MDs blame lack of beds. Patient pile up in hospital emergency rooms causing chaos. Where have we heard that before? This is Dateline Calgary, and this is in 2009. All right, 2009. The reason I bring this to your attention, I was watching my man Anomaly. Hold on just a second. Let me find the video. My man Anomaly here, who is doing he did a video earlier on how the Guardian in the UK every year has talked about NHS, National Health Service, facing winter crisis. Hospital bed occupancy hit records, high risk, risking care. Hospitals in England told to put operation on hold to free up beds. NHS bosses sound alarm of a hospital's already running at 99% capacity. I'll put a link in the show notes to my man's Anomalies video here. Hospital fear mongering. Remember this. Let's. I want to show you guys something else though. This whole thing is nuts. Cutting waiting times to take backseat to H1N1. All right. Hospitals be allowed to suspend push to short wait visits. Eastern Ontario hospitals may have to put on hold government-funded efforts to drive down medical waiting times. The resurgence of flu this fall overwhelms the healthcare system because H1N1, are we ready? Experts warn the most dangerous flu strain since 1919 is coming back. Let's see. The Ottawa Hospital and Montfort Hospital have pledged over the next year to shorten emergency room visits markedly for patients, knowing that they risk having a portion of the provincial funding clawed out of their budgets. They don't tackle the delays, because they're having huge hospital delays as it was because their version NHS. Swine flu hits 40 years old the hardest. Canadian doctors probing worst cases of swine flu have made a striking finding. 40-year-olds, many previously healthy, appear more at risk of developing severe swine flu. The finding is based on global reports of illnesses and case reports from critically ill patients in ICU units. It also confirms that the virus behind the first flu pandemic of the 21st century does not fit the typical patterns of influenza. Although there are certain people who become critically ill with the virus that have comorbidities, it has been remarkable. This virus has been remarkable for its ability to cause illnesses in patients that don't have chronic weaknesses. Interesting, huh? And this is from the first article about the lack of beds, but it's also possible some of the ongoing pressures that plague hospitals, bed shortages, cancellation of surgeries, and long emergency room waits could ease if demand for routine medical procedure drops because of a pandemic. In particular, patients may decide to postpone elective surgeries to avoid overburdening hospitals out of fear of catching flu in the overcrowded hospital wards. It may be that if elective surgeries grind to a halt and all the associated expenses also grind to a halt. The point is we don't know what's going to happen. As Ottawa's medical officer of health, when 2003 SARS epidemic broke out, he remembers hospitals during that time as very quiet places, largely because public access was restricted in an effort to stop the infection from spreading to the community. He worries that some frail and vulnerable patients could opt to delay medically necessary procedures and avoid doctor's offices altogether because of the worry of the. Look familiar? Bug called worst in years. Check that out. Look at that. Does that not look like something we've seen? Like the coronavirus? The influenza outbreak laying siege across entire regions of North America shows no signs yet of peaking. Although some relief is on the way in the forms of new drugs to alleviate flu symptoms. Some doctors said that local hospital clinics continue to see large groups of sufferers seeking treatment of what is termed the loose flu in several years. And hospitals are pressured, surgeries postponed. Hospitals that have had to either borrow ventilators from other hospitals, possibly in Detroit, and transfer patients to other hospitals. At one point, he said 2 patients unexpectedly need ventilators, and only emergency one was left, and there's only one left. Fortunately, 2 other patients were able to be taken off ventilators. It seems like we've been through this before. And there you go. Look at that. Isn't that interesting? That doesn't look familiar. All right, let's keep going. Pneumonia stressing hospitals. Resources staffed, taxed to the limit. The intensive care units of both city hospitals were full Friday, mostly with patients suffering from pneumonia, many on ventilators to keep them breathing. Only 1 ICU bed and 1 ventilator, both reserved for emergencies, were left at each hospital. It's like number of cases of the flu. Throughout the United States, 3.7 million cases of flu have been diagnosed so far. There have been 1,800 flu-related deaths and more than 32,000 hospitalizations nationwide. We've seen a lot more cases earlier this year. It's hard to tell, but I personally don't think we've reached our peak yet. In Franklin County, 19 people have been hospitalized for the flu so far this year, according to the state. That equals the number of hospitalizations the whole time last year. From December 8th through December 14th, there are 247 cases of flu diagnosis in Franklin County. That's Ohio. Columbus's current numbers are typical for Central Ohio at this time. But Roberts, the medical health commissioner, fears the virus become more widespread after the holidays. When I look at the national data and I see whenever people travel, I know a lot of people doing that. I worry they could be exposed to the flu and come back and bring it back home and give it to someone at home. No children have died from the flu in Ohio yet this year, though 19 kids have died across the U.S., the CDC reported. Nationwide, Children's Hospital has already admitted kids with the flu this season to ICU, and the hospital expects the number of cases to climb in the new year. 80 to 90% of patients at nationwide children get the flu vaccine. He warned the virus has the potential to kill not just toddlers, but teenagers too. There are a few things that can get a healthy, strong teenager in the ICU, and one of them is the influenza. Anyway, so that was from 2019. All right, so the issue is from 2000, 2009, 2019. That was literally, I just looked at this for the last half hour. That's it. We've had all these issues of flus, all of them. The only time they've ever closed everything down was this time. We had the worst flu outbreak in 2000. We obviously had SARS in 2003. We had H1N1 in 2009, for which my oldest got sick by it. It was bad, dudes. And she had no comorbidities. She was 2009. She was 9 years old, and she got sick. And it shut down. We'll see you.